In this video, there's going to be 10 different stations. I'm going to ask you guys 10 different questions. You're going to be able to read the question on screen, and then you're going to have a moment to pause the video, read it properly, think of your answer. Then you're going to hear my model answer. Some of them are going to be good answers, some of them are going to be bad answers. So it's just going to kind of give you an idea of what's good and what's bad, what you should try and avoid in your interviews and what you should try and emulate. Then I'm going to give you some tips on how you can answer these questions. So starting off with the first question, question 1. You're a first year medical student on your way to anatomy and your friend texts you saying that they're really hungover and not able to come in. They ask you to sign them into anatomy. What would you do in this scenario? So in this situation, even though it was my friend, I probably wouldn't sign them in, just because I know like it's probably not the right thing to do. They can always catch up, and they can probably like ring in sick or just let their tutor know that they won't be able to come in for that session. I know that they are hungover, but I'd probably try and see if there's just any way that I can help my friend and see if there's anything that I can do to help them, and then yeah, I probably just wouldn't sign them in. So with this question, the obvious things that you really want to touch on is obviously doing the right thing. This is probably going to be in their mark scheme, like did you actually say that no, you wouldn't sign in your friend, because that is kind of the right thing to do. It's similar to the SJT and the UK CAT or the UCAT now. You kind of want to think about all the documents that you've read, good medical practice, tomorrow's doctors, whatever that would say is kind of what you want to say in your interview. Also, if you can kind of touch on helping your friend and encouraging them, like giving them, you know, your notes after you finish anatomy, or like helping them catch up, that would be good as well. You definitely don't want to kind of say in your answer that like, yeah, I would do it, it's just a one-off, that sort of thing. You definitely want to avoid that. For this question, they want to check that you do understand why it's wrong as well. It's wrong because it's being like, you're not being honest, and you're not being like, you're not having integrity, which is all like really important things for anyone who wants to become a doctor. So that's the kind of the key thing that they're looking for in this answer. Question 2. Imagine that you're a medical student on a hospital ward placement. How would you explain to a patient that they need to have another blood sample taken as the results of the last one have been lost? So in this situation, I can only imagine how the patient feels. I know having your bloods taken is really, really uncomfortable because you have a needle going into your arm, and some patients have like massive phobias of needles. So I would try and apologise as much as I can, and just let the patient know that we're so sorry. I would explain that, you know, because she needs these blood tests, that she does need to have them done again. I would try and explore the patient's like how they're feeling, and try and check like, you know, whether they're uncomfortable with it or if they're really unhappy with it. I can imagine some people might not be happy with their like personal material being like out there, being lost. So I'd try and understand how the patient feels and get their perspective. Then I would apologize as much as I can, try and reassure the patient that they know that, you know, how sorry we are as a team and how we'll try our best not to let this happen again. This is one of those questions where empathy is super important. In your answer, they're kind of looking to make sure that you can understand things from the patient's point of view. So for some patients, they might be really scared of needles. So if you can touch on that, that would be really good as well. In this sort of answer, it's really important that you apologize to the patient and be polite, even though you might feel inclined to be like, you know, this sort of thing happens from time to time. Try and avoid saying things like that. Another great thing that you can do is kind of ask the patient about what they're worried about. Like, I know that you've lost your blood sample, but is there any concerns or worries that you have? For example, some patients might be worried that there's like a blood sample with their name, age, maybe their address on it. They might be worried that that's kind of like out there in the hospital or like with someone random. So if you can ask the patient what they're worried about, or if they have any concerns, that would be really good too. Okay, next question. Question 3. Why do you think teamwork is so important in healthcare, and what skills do you have that will help you integrate well into a healthcare team? Teamwork is so important in healthcare because there's just so many different like patients. Obviously, if you think about a hospital, there's so many different wards with different specialities. It's essential that you've got so many different healthcare workers, different professionals, different people who specialize in different things. It's just essential to help optimize the care that the NHS offers. And also, I think to kind of reassure patients that sometimes if the doctors and nurses are busy, they'll be seen by the HCAs or they'll be seen by volunteers and other healthcare staff. I think sometimes it's reassuring when patients are seeing lots of different people who are looking after them to make sure that they're not on their own. They've got a bunch of different people who they can refer to and speak to if they need help. In regards to the second question, I've done lots of different things during my time at sixth form and at school to make sure that I've got lots of skills that would be helpful and beneficial in the world of medicine. So I've played netball for a really long time now, and I feel like I've really developed my teamwork and communication skills. It's absolutely essential in any sport that you've got like good teamwork skills, because you're only as strong as your team. It doesn't matter how amazing and incredible at netball that you are. It's just important that you can work together with your team, communicate, talk about what's going well as a team, what's going badly. That's just so important in any team, and I'm sure that applies to the NHS as well. I've also been a part of school council for a long time now, and I've really developed my communication skills there. I feel like I'm really confident doing a presentation now. I'm really confident speaking to lots of different people, like other students, staff members, teachers, even other parents, and I'm sure that those skills will translate well into medical school and beyond. So in this answer, similar to your personal statement, you kind of want to list the things that you've done as well as what you've kind of learned from those experiences and what you've gained. So great things to talk about with this would be anything like DV, any teamwork sort of things that you've done, netball, school council, sports teams, clubs, things like that. Like if you want to mention those, that's a perfect example really, but make sure to kind of talk about what you've gained. And if you've got time, you could even talk about like a scenario when teamwork was super important. Like, was there a moment when you're playing a sport and like you as a team, you really worked together and you played a role in that? That would be a good example to touch on as well. An example of a bad answer would be if there's absolutely no reflection and you're not even answering the question. Because this is a two-part question, try and kind of structure it like this is what I'm going to say first and then second. So I think in a bad answer you kind of only answer one half of the question. If you also give like a very simple answer where you're just kind of like, yeah, teamwork's important because like the NHS has a lot of people in it, like you need to like elaborate a little bit more than that. For some stations you've got 7 minutes, which is absolutely ages, so you've got time to elaborate if you want to. Okay, next question, question 4. How has the COVID-19 pandemic impacted your motivation to become a doctor? I feel as though the pandemic has motivated me even more to pursue a career in medicine, not only from what I've seen online in the news and what I've researched, but also from my own work experience. I wasn't able to get in-person work experience due to the pandemic, but I was able to have the opportunity to get some online work experience, and from that I learned that teamwork and collaboration, communication is just at the absolute core of the NHS, and making sure that the patients get the best quality healthcare that they possibly can, even in the middle of a global pandemic. I feel as though the pandemic has really highlighted the extent that doctors and nurses are willing to go to make sure that patients are at the centre of everything and to make sure that they're okay. And it also highlighted to me that there's so many factors that contribute to the NHS and the healthcare that's offered in this country. For example, it doesn't matter if we have the best quality equipment, services, the best doctors in the world. Sometimes there are factors like shipping equipment and delays and the government and policies and guidelines and funding that can affect the quality of care that patients get. That was really interesting to me because it was something that I didn't actually think about before. And in general, I feel as though the pandemic has highlighted some of the negative sides and not so glamorous sides of becoming a doctor. So even though it's something that I still want to do, even after seeing all the negative sides, for example, the long hours, you know, the really difficult and time pressured environments that they're put in. It's really difficult for doctors to work in an environment where they have to see patients really quickly and they're under a lot of pressure. But I didn't know that that can apply to other areas as well, especially during a pandemic. So it's highlighted to me the good and the bad, but I still really want to pursue this career. I know some of these answers in these questions are very short, but it's just because I want to give you guys like an example of what you could say. I know, like, for example, imagine if I was talking for 7 minutes, 10 times. This video would be so long, so I've kept the answers short just to give you like a flavour of what you can say. But a good answer would kind of be something that's reflective, like talking about your experience of the COVID-19 pandemic. Obviously, for a lot of students, I guess it's similar because it's like school was cancelled, but you can definitely talk about your own personal experience, especially in this answer, like how has it impacted you? For some of you, like maybe you've got family and friends that like were working, doctors, nurses, or even just anyone that's an essential worker. You could talk about how like them working and seeing them go to work and stuff, how that's impacted impacted you, and try to avoid any like stereotypes, the things that are just a bit too drawn out and a bit exaggerated. Like, of course, during the pandemic, doctors were literally saving lives every single day, but don't kind of like over dramatize it, if that makes sense. Like, because they'll be able to tell if you're actually speaking from like your own experience, or if you've just like read some things, you're just like regurgitating that, if that makes sense. Okay, question 5. Imagine you're a doctor and you're seeing a parent whose child is in A&E who's frustrated about the time they're having to wait. How would you respond to this parent? So in this situation, I can really empathize with the patient. I would definitely try and understand both of their perspectives. So I would first and foremost speak to the patient to check that they're okay. Is there anything that we can do to maybe help them, make them feel more comfortable whilst they're waiting to be seen by a doctor or a nurse? And then what I would do is speak to the parent, who I understand is feeling a little bit frustrated. I would just try and explain why they're waiting. Sometimes in A&E, usually in A&E, the patients that are most life-threatening and need to be seen critically, they're seen first. And then, you know, people who are very badly injured, but it's not as life-threatening, they're seen as soon as possible afterwards. So I would explain that to the patient's parent, and hopefully they would understand that. I think in this situation, it's probably best to just be really professional and really cooperative and just see it from their point of view. And if there's anything that they were worried about or concerned about, try and speak to the doctor to see if that could be resolved. And I would also speak to the patient themselves, the child in this situation. I would see if there's anything that I can do for them, and just trying to get their point of view. Similar to a lot of the previous questions and answers, you really want to be empathetic. I think that's like a running trend. If you've got a role play station in your interview, which is most likely going to happen, because for a lot of medical schools, they put on their website like what they're going to actually test you on and what they're going to interview you on, and quite often they'll put role play. So being empathetic is always crucial. Just always, empathy is pretty much just putting yourself in the other person's shoes. Like, imagine how they would feel. You really want to be professional as well. In this situation, it's easy to kind of like, some people might like kind of go back and forth with the parent and not be very professional. They might start to like be really antagonizing. You definitely just want to be as professional as you can and be respectful of them. Even if they're shouting, you don't want to like raise your voice at all. You want to kind of just remain professional and stuff like that. Another good thing to do is ask for their perspective. So obviously they're frustrated, but ask them why. Like, is there a reason why you're frustrated? Like, is there anything we can do for you? Doctors normally, even though patients are waiting for a long time in A&E, they'll normally give them like painkillers in the meantime whilst they're waiting to be seen. So usually they shouldn't be like waiting in pain or anything. So ask the patient, the patient's parent, if there's anything that they can do. If it's a role play and the actual patient is there, like the child, you can also kind of include them if you want to. You can ask them like how they're doing, like how are they feeling, is there anything that you can do for them. In general, you want to avoid like being rude. Obviously, I feel like it's obvious, but there's people that do it, which is so strange. Like, you're literally in your interview, like how are you like being rude to a patient? With a lot of role plays like this, honestly, it's a lot easier than you would think. There's nothing like magical that they're expecting you to say. There's no magic sentence that's going to get you full marks. There's no like thing that you need to say that's going to like get you to like pass that station. It's literally just being empathetic, understanding and professional. Okay, question 6. What challenges do you think the doctors involved in the Charlie Gard case faced? In this situation, as a doctor, I can imagine they face so many challenges. I think the media attention and the media scrutiny probably might have been a really big one. I read on the news that a lot of doctors, and not just doctors but healthcare professionals, did get a lot of death threats and attacks, and just like their safety might have been at risk. So I can imagine that was a huge challenge. But also, even speaking to Charlie's parents themselves, I'm sure that was really difficult. Trying to explain to his parents that sometimes treatment isn't always the best decision for a patient, and sometimes it might be best to let them pass away with dignity, and in their last few days let them have time with family, let them be in a comfortable position, or as comfortable as possible. And I'm sure it was really difficult for the doctors as well, because they want the best for the patient and the parents. So it's probably really difficult for them to battle with the idea of knowing that the treatment being given to Charlie isn't actually, it doesn't look great, it doesn't look like it's going to really help him get better, but then also they know that the parents want Charlie to get better. So it's really difficult battling those two things of knowing that the treatment isn't helping, but knowing that you really want to help the parents. I can imagine it was really difficult for them to battle with the ethics of this situation as well. There was a lot of ethics involved, especially if you think about beneficence and doing what's best for the patient, and then juggling with that with non-maleficence, not doing any harm to the patient. You might the first thing that comes to mind with beneficence is helping the patient as much as possible and giving them the treatment that they need, but then also you don't want to cause harm to the patient in terms of prolonging their suffering and their pain and stuff. So it sounds like such a difficult position to be in as a doctor. So this is like a medical ethics / empathy question again. Empathy is involved in a lot of these. In case you haven't actually heard of the Charlie, I'm sure you've heard of it, but in case you need a quick summary, essentially Charlie was born with a very rare disease. He deteriorated a lot in Great Ormond Street Hospital, and there was so much back and forth, but the High Court essentially said that like his life support should stop because he should be allowed to die with dignity. His parents weren't happy about this, and they kind of got in contact with other doctors. There was a doctor abroad who offered some like life-saving treatment, and his family managed to raise over £1 million to get him over there and get the treatment. Regardless though, the High Court and a lot of the doctors, the family, they were back and forth, and it was still decided that he should just be, his life support should be terminated and he should be able to die with dignity. This is a great question and an opportunity to bring in the 4 pillars of medical ethics. So beneficence, autonomy, I already said that, non-maleficence and justice. In this case, autonomy is a difficult one. That's where you can decide what treatment you want to have. Charlie was, I think, only a year old, if not younger than that, so he can't decide for himself what he wants to have. So in that case, it's actually the parents, it's given to the parents at that point. And this is an opportunity for you to kind of talk about how the doctors probably would have really struggled speaking to the parents, because the parents obviously want the best for him. They want the life support to continue, but then from the doctor's point of view, they kind of want Charlie to die with dignity. And that's kind of where beneficence comes in, and also non-maleficence. Like, they don't want him, because it also says, I was reading about it, and it says that they don't know whether or not Charlie was feeling pain. They don't know if he was suffering in his last few days or not. So from that point of view, it's kind of the doctors not wanting their patient to go through lots of suffering and lots of pain and stuff, especially in their last days. So that's something you could touch on as well. Also, because of how high profile the case was, another frustration or another challenge that the doctors might have had is just like a lot of like press or like being in the news. I heard that apparently there was people like attacking the doctors and nurses and just sending a lot of the healthcare staff like death threats and being awful to them, because it was massive in the news a few years ago. I think it was like 2016. I think the main place where you're going to get most of your marks in this station is pretty much being really balanced. So not being too one-sided with the parents and kind of like criticizing the doctors, and also answering the question as well. So you might be inclined to like explain the Charlie Gard case, but that's actually not the question. It's kind of like in your exams, like sometimes you might read a question too quickly and you answer like a different question. You want to make sure that you're really answering this question, because that's what the mark scheme can be based on. Okay, next question, question 7. Do you think the NHS would benefit from automation and artificial intelligence? I definitely think that the NHS could benefit in some areas with AI and artificial intelligence. For example, I know that artificial intelligence can probably make certain things a lot faster, a lot more efficient. For example, the waiting times in A&E, every single winter I hear about them being really, really long and trying to get the wait time under 4 hours. If it's possible, there might be a way that AI could get that to make that possible, get the target, you know, within range. It's also possible that AI could help with staff shortages. Even though we don't have as many staff members working in the NHS, it's possible that if AI comes in, they might be able to fill that gap. It's possible that that could help alleviate some of the strain that the NHS currently has. Some of the not so great sides of having AI in medicine is the fact that you might actually have like the potential for more people to hack into systems. There might be more data breaches. There might be like release of confidential information, which patient safety would be at risk in that case. Also, it might take a while for staff members to adjust to the new systems, especially if it was rolled out across the UK. And depending on where the AI is implemented, it might be a lot less personal as well. A lot of the time, patients are seeing actual people. They're speaking to nurses, HCAs, doctors. If they were potentially just putting in information into a tablet, or if they were getting some form of treatment from some technology, it might be less personal, which would affect, I guess, the patient experience. With this answer, try and be as balanced as you can. Try and think of some pros and cons. You've got 60 seconds before the station, before you go in. If it's like this question was really short, like it takes you like 20 seconds to read it, if not less. So you've got a few, like you've got nearly a minute to think of your answer, think of some pros and cons. Yeah, if you've got time, it's worth emailing them and asking like, can I bring in like a notepad to just jot down my answers in between stations? They might say yes, they might say no, but if you don't ask, you never know. So yeah, try and think of your answer, try and think of some pros, some cons, because that's what they want. They want you to be balanced. It's a really important trait of like a doctor and a medical student, that you can have like a balanced and open-minded point of view. They don't want you to just be too narrow on like one choice. It would also be really good if you can refer to patient safety, so that when it comes to AI and like artificial intelligence, that's a key thing that a lot of people are worried about, that people might like hack into the systems, and like patient safety might be at risk and stuff like that. So touch on that if you can, and also refer to like the staff as well. It's going to be staff and doctors, nurses, other healthcare people who are going to be using these systems, so try and include that in your answer as well. Question 8. Do you agree with the government's decision to keep schools and colleges across the country open during the pandemic? Personally, I don't agree with this decision. I think that it's such a difficult position for the government to be in, to have to navigate the education sector, the university sector, the business sector, and then the NHS. I think it's such a difficult position to be in, but I think that the education as a whole, especially for those who are in sixth form, in college, doing their GCSEs, was massively affected. I think that in general they didn't do a very good job, and I think that it's quite unfair as well on students that we missed out a lot on our education. Similar with all the other answers, you want to be balanced. This is a great question for you guys that are kind of in the middle of your A-levels, because I'm sure you can speak from experience. Try and list a pro and a con, so kind of, if you can, go back and forth. It's okay if you list all the good and then all of the bad aspects, but I think it looks more balanced if you go back and forth. But yeah, when it comes to sharing your experience, try to keep that brief. Again, answer the questions. The question was talking about, do you think the government made the right decision? So you can touch on your own experience, but try and go back to like, did the government make the right decision? Yes, no, and here's why. An example of a bad answer would be someone who's kind of focusing a little bit too much on their self. Like, the question isn't how did the pandemic impact your education, it's do you think the government made the right decision in putting schools and colleges closing them during the pandemic. So yeah, don't focus too much on your own experience and like your own opinion. Try and talk a bit more about the question, which was like the government and did they make the right decision and stuff like that. Okay, we're nearly there. Question 9. The NHS is a free healthcare service in the UK. What do you think the pros and cons are of having a free healthcare service versus charging patients for their care? I think we're very lucky in the UK to have the NHS. I think we live in a country where everyone, regardless of their income, has access to healthcare, which is super important. That in itself will have a lot of positives. For example, a lot of people won't be struggling with their mental health, knowing that they can't afford healthcare, or worrying about how they're going to afford, the next treatment or their next set of tablets. I think that's really important. Also, I think as a country as a whole, because we've got free healthcare, it probably means that everyone is generally a little bit healthier compared to some other countries where their healthcare might be a little bit more expensive or even private. Health inequality, to my understanding, is just when there's disparities in the health of different people across the country. So some people might be really healthy, possibly because they can afford private healthcare, and then there's people who can afford less. In the UK, I think we probably have less of that because everyone had access to the NHS, which is completely free, so we probably have less of a difference in the healthcare that's given. Hopefully guys, you could tell that this wasn't actually a very good answer. Like, I was very one-sided. I was kind of like, well, yeah, it's good to have a free healthcare service, but I didn't actually touch on the more bad ones. And this is probably a very common answer that I gave, because a lot of people might not actually know some of the benefits of having a paid healthcare service. The first thing that comes to mind is that it's so unfair, and that's true, and that's kind of what I touched on in my answer earlier. But there are some pros that I think is worth knowing, because this could be a question that comes up. So here are some of the pros of having a paid healthcare service that I didn't mention in this answer. So the NHS tends to be quite short of funding quite a lot, especially when during the winter, where there's like the winter crisis. Having a paid healthcare service might help a little bit, because there's actually like more money in the healthcare service, so it's like there won't be like crises all the time, and there won't be like shortages and stuff, because there's more money to like pay for those things. However, obviously a lot more people would be without healthcare. Healthcare inequalities would probably go up massively, because so many people can't afford the healthcare if people were paying for it. For example, in America, it's quite a common thing, I'm sure you guys have seen as well, like some people can't afford basic medication like insulin if they've got diabetes. Some people, if they get chemo, which is very expensive, they'll have to like sell their house in order to pay for that. And also quite a big one is that the NHS is like the main provider for our healthcare, but if we were to have a private system, it means that we probably would have other companies and businesses come in. So it wouldn't just be like you need treatment, the only option is the NHS. You've got like a few different options, so that means that each one will probably be competing a little bit to have like the best healthcare possible. So it means that we probably have better healthcare than we do now. Question 10. There are circumstances where being a doctor can be a very stressful job, especially during a pandemic. How will you cope during such circumstances? In general, I would consider myself quite a resilient person. There's been a number of occasions where my determination has been really tested, and I've really had to decide whether or not I want to keep going and keep working hard towards something. For example, I remember one time when I was doing a biology exam, I was really struggling, and then eventually when I got my results, I found out that I'd failed that exam. That was a real moment where throughout my time at school, I'd always done really well, but from that moment on, I really had to put in a lot of hard work to carry on and get my grades up and start to get good grades and get A's. I would consider myself quite a hard-working person, and just because I've been like knocked back or I've had like a tough challenge, that doesn't mean I'll give up. I would consider myself really determined and resilient. I'd also say that I'm quite organised. I like staying on top of my work and not letting things pile up before I start to get on top of them. That applies to all my work, not just at school in sixth form, but also my extracurricular activities and all my hobbies on the side, even my university application. I try and be ahead of the I try and stay on top of things and be ahead of deadlines. I don't leave things until last minute, and that just applies to everything in my life. And I think these are all really important skills that could be applied to life as a medical student and even life as a doctor as well. This is a question where they're kind of hoping that you can reflect on your own personal skills, qualities, all the things that you've gained, all the D&B, netball, sports clubs, school council, everything like that. They're wanting you to kind of talk about what you've gained from those things. So a really good answer would be an example of someone who's really reflective, talking about their skills and how they've demonstrated them. So if you're talking about communication, think of a scenario or think of like an opportunity where you've like really developed that. Like if you've been in school council and you've really worked on your communication, that's a great thing to talk about. Or if you're going to talk about like you're a resilient person, talk about a scenario when your resilience was really important and where you really like developed that. Hopefully that has helped you guys. Last year I made 2 of these in MMI interview season, so let me know if you want another one because I can definitely do that. But yeah, I really hope you enjoyed this video. Bye.